To me, I think some people might think a virtual nurse can't provide the same quality of care that a bedside nurse might be able to because of that lack of physical touch or presence. But I think a virtual nurse can have the same sort of presence that a bedside nurse does. I like to think of a virtual nurse as pulling up a virtual chair next to that patient and spending time to ask questions and engage with them. What I see a virtual nurse is another member of the care team whose care complements the care the bedside nurse is providing.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Laura Gartner, Associate Chief Nursing Informatics Officer for Inpatient Shared Services and North Region at Jefferson Health in the Philadelphia, Pennsylvania area about virtual nursing care. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Welcome and thanks so much for joining us today, Laura.
Thank you for having me.
So I think we all recognize that in the last few years, certainly post-COVID, we've seen a major increase in the use of telehealth, telemedicine. Can you give us a brief overview of how virtual nursing kind of fits under that umbrella? And how might it differ from other forms of telehealth that we might be familiar with?
So to me, Jaime, a virtual nurse is a nurse who provides care remotely using technology. That nurse becomes part of the treatment team, provides care to the patient, and supports the bedside staff. This is very similar to telehealth in general. According to the dictionary, is the provision of healthcare remotely by means of telecommunications technology. And that's a really broad term that can mean any number of things. So for example, a telehealth visit can be an episodic visit with your primary care physician in an ambulatory setting, or it could be continuous video safety monitoring to prevent falls in an inpatient hospital, or even trending a patient's blood glucose levels remotely using a monitor that sends information back to the clinician. For our purposes at Jefferson, our virtual nurses are in the inpatient setting using two-way audiovisual devices so they can see the patient and the patient can see the nurse.
Well, thank you so much for providing that as sort of background definition, because I think you're right. The terms are sort of interchanged a lot. A lot of things kind of fit under that umbrella. So thanks for kind of specifying how at Jefferson, how you guys are implementing this virtual nursing. What I'm always struck by, my clinical practice is in ambulatory care, outpatient clinic. And I'm always struck because we've been doing telehealth on the telephone forever. It's like the mainstay of our practice when our patients aren't live in front of us in their home. So I think this is a great development to see how it is morphing and changing to meet the needs, not only of patients, but of nurses. So along those lines, I think we've all also been aware of the shortage of nurses that we're experiencing across the country in recent years. So how do you see virtual nursing help maybe alleviate some of these staffing issues?
So I think that the virtual nurse plays a really important role in nurse staffing shortages. With this shortage, we need to get creative and think outside the box so that we can facilitate nurse wellness, work-life balance, and satisfaction, and make our hospitals the place that nurses want to work. I firmly believe that nothing can replace the physical touch, but there are so many things a nurse does every day that can be done by somebody remotely that can reduce the workload of that bedside nurse. So for example, a virtual nurse can do admission histories, daily and discharge education. They can communicate with the patients or their families. They can provide documentation assistance through scribing or things along those lines. And they can mentor new nurses. So all these things can help take away some of that workload from that bedside nurse and perhaps lead to less burnout, more work satisfaction. If you give mentorship to that new nurse, they might feel like someone's got their back. They might want to stay on that unit longer. I just think there's just so much that we can do to provide support to our bedside nurses who are working so hard.
Absolutely. I love all of those options you provided. Just kind of makes my mind spin a little bit of just how great some of those supplements would be. I mean, again, it's basically just expanding the care team. It's trying to offload some of those things that don't require that physical hands-on piece that can be help monitored or provided in a virtual way that does not at all take away from the quality of the information being shared or the information that's being monitored. So it is exciting to hear how a lot of different centers across the country are using this to help improve the quality of life for their nurses, essentially. So tell us a little bit more about your virtual nursing program at Jefferson Health.
So Jefferson Health has had a little bit of a journey with virtual nursing. So almost 2 years ago, we began to look at virtual nursing as part of an alternative care model project. And we sent out an RFI to a couple of vendors, started the conversation with our nursing leadership and other staff. Towards the end of 2022, we anticipated a pediatric surge due to the RSV, flu, and COVID. So we began to prepare a pilot for virtual nursing with this population. Long story short, we ended up not having a pediatric surge, which was great, but pivoting to a med surge unit to do a brief pilot. So we started a pilot in March of 2023, and that pilot concluded in June of 2023. And since then, we've been working on our next phase, which will be at a different hospital in our system, 2 floors in this particular hospital, also med surge units. And we will provide virtual nurse care 24/7, 7 days a week. Our first pilot was 12 hours a day for 5 days a week. So we're expanding it this time around. And this new phase will begin in June.
That's amazing. So the nurses that work in the virtual nursing program, are they dedicated employees, or is this something that like all nurses would rotate through or take shifts in?
That has been a very big topic of conversation. With our first pilot, Jefferson has a float pool that goes across the enterprise. So we had 2 nurses who volunteered to take a temporary assignment as a virtual nurse for that 3 months. This time around, we are borrowing, so to speak, nurses from the floor that we are piloting the program on. So about 8 nurses between these 2 floors have volunteered to take on this role as a virtual nurse. And so they will come right from that floor. But there's a lot of conversation about whether you should use staff from the floor, if you should use other people, things along those lines. But right now, we really hope and think that the nurses we've identified for this phase have a relationship with these units. They know how the units work, and that might help get everybody working together nicely.
Absolutely. And certainly during kind of the pilot phase, the growing phase, having consistency and kind of working out maybe some of the kinks, it's like consistent, the same people. Certainly I can understand that. You know, when I kind of compare it to what I'm familiar with, which is like a triage nurse in the outpatient. Again, we see consistency creates, you're talking to the same patients a lot. You kind of know the routine, you know who you're going to call and ask for follow-up. So definitely see those kind of connections there. But on the other hand, I can see this down the road if it does become something that nurses are able to rotate through or take certain shifts on, like how that variability for them might be a satisfier to have that option to work some on the floor, work some in this virtual environment. And as you said, if you know the people that you're virtually supporting, even greater, even better, it creates that trust in that environment.
Absolutely. And just to go back to one of your previous questions, what we've heard a lot from people I've spoken with is another way to address this nursing shortage is to keep some of that expertise at the bedside. And a virtual nurse shift is one way to do that. So there's nurses who may not physically be able to do bedside care anymore, or who just may need a break from that, who with the right training and the right competency can become a virtual nurse and have some flexibility with their schedule, perhaps work from home if that's a possibility with your program. That's another way to keep nurses in the hospital taking care of our patients.
And you even mentioned one feature of this program is supporting newer nurses who are bedside, who are in practice, but still need and would benefit from having someone they can ask all these questions to. And we know that because of sort of the constant churn of new nurses and people kind of moving around, that our preceptors are burning out themselves of just having to constantly train. Not that they don't love it, but again, after you're doing it one after the other, it does take a toll. And so having this sort of virtual option to be another layer of support for new nurses who do have those questions, it will again take that burden off those preceptors who are at direct care. So again, I just think everything you've described and all the ways that you're trialing at Jefferson Health, and I know other institutions are trialing this as well, it's very exciting to think about all of the benefits that this type of program could offer, as long as, again, we can just take our time and be intentional about piloting it, gathering the data, understanding what benefits it can provide, and then being able to implement this more broadly across the country. Speaking of measuring kind of the impact, what type of outcomes have you been able to measure from your program?
So we've been looking at a lot of things. For our first pilot, we really looked closely at length of stay and other related measures, such as the discharge order time to the actual discharge. There's been a huge focus at Jefferson to reduce our length of stay and observation hours. And so over that 3-month period, we had close to 400 patients that had virtual nurse visits. And of the 4 data points that we looked at, which were the length of stay for inpatients, observation patients, and that discharge time to actual discharge, the average discharge order to event for inpatients saw the biggest difference between the non-virtual nurse cohort and the virtual nurses. The length of stay for inpatients saw some improvement, but it wasn't statistically significant. Going forward, we're going to continue to look at these metrics as well as other things. So we have worked with our business intelligence team to create dashboards to look at things such as time spent documenting for the nursing staff, the virtual nurse, as well as the bedside nurse. We're going to look at some nurse sensitive indicators, falls, things along those lines, medication errors through our incident report system, things like staff satisfaction and nurse turnover. We have a pre-survey that's gone out already we have a couple doctoral students who are working on virtual nurse as their project, and they are surveying their nurses right now, particularly the new to practice nurses. And then we'll follow up with a survey a few months into the pilot. And then, of course, we're looking at the patient experience, our HCAP scores, things like nurse communication with the patient.
That's amazing. I think, again, all of those outcomes are important. And it sounds like you're trying to kind of broadly measure all of the various types of impacts this type of program can have, recognizing that it's not a singular intention for this program. It can do all of these things at once. And so I think it's great to hear that you're measuring these things, that you've got students, doctoral students who are using this pilot as something that they can study. Hopefully they'll be publishing their outcomes, because I think the more information we have in the literature to inspire and support other programs who are trying to pilot and implement this themselves, I think that will be what we need to help grow this type of program. So what do you see as some of the lessons that you've learned from your implementation, and maybe what challenges that you've encountered along the way?
So we definitely had a lot of lessons learned with our first pilot. And I think that was the biggest value of that pilot, was to kind of feel our way through some of the questions that come up, some of the things that we now know to anticipate in the second phase. Specifically with the technology you use, we found that it was really important to have a virtual knock for the patient so that you're not just popping into a room and taking a patient off guard. Privacy features for the patient. So if there's a camera pointing at the patient all the time, that gives a patient a little unease. Is somebody watching me? And when we weren't really watching them all the time, it was intermittent care. So having a camera turn away from the patient when it's off, or have a clear indicator that it's not on. There was a lot of conversation about continuous versus intermittent observation. Should you be watching patients all the time? Can you really be watching patients continuously, or should it be more intermittent? We realized that intermittent visits were what we wanted for our patients rather than having them continuously monitored. We learned that it's really important to minimize any effort required from the bedside staff. So if you have a mobile camera, for example, and you need that nurse to roll that camera into the room and plug it in and make sure it's positioned correctly, sometimes that bedside nurse just is frustrated with that because they don't have the time, or they don't know what they're doing with that technology, or something along those lines. So it's really important to kind of have things seamlessly fit into their workflows. It was really important. Another thing we found, to have a consistent user interface for the virtual nurse. So if you have that virtual nurse going from one type of software to another, to your EHR, and clicking all over the place, that's frustrating for that person. Something that we'll have the ability to do in this next phase is for the patient to contact the virtual nurse directly. So right with our previous pilot, the patient couldn't call the virtual nurse directly. He or she would have to use the call light, call the bedside nurse. But there's a lot of things that a patient could just directly ask a virtual nurse, like if they had a question about a medication, or they want to know when the next thing is due. And so with this next phase, we'll have that ability for them to call. In terms of lessons learned with the virtual staff, we've discovered that, I don't think that you can just take any nurse off the floor and put them behind a camera. There is a bit of a webside manner, if you will. People need to be comfortable doing things remotely where they can't touch the patient. Having a conversation with somebody through a camera might not be a skill that everybody has or is comfortable doing. There was a lot of question about on-site versus off-site. So do you have your virtual nurse work remotely from home? Do you have them work on-site? And I think that answer is still left unanswered for us. I think in the future, it would be great for nurses to have that opportunity to work from home, since that's what a lot of nurses are looking for, and that would provide that flexibility. But for our next phase, they will be on site in a remote location. And then hours of operation. Do you staff a virtual nurse during the busiest time of your day? Do you have them 24/7? We found that the hours of 9A to 9P, which went into that night shift a little bit to hit some of our heavy admission and discharge times, But that 2 hours into night shift didn't really work for us. It wasn't enough time for that night shift nurse to get really engaged with the program and the virtual nurse. And so we think that this 24/7 model will be more effective. And if we do need to scale back to 12 hours a day, we've talked a little bit about 11A to 11P. And then in terms of bedside staff, it's really important to engage your nursing leadership and that staff early and often. And it's important to get that nursing feedback for what they feel like they need help with, how they want the program to work, so that, again, it fits into their workflow.
A lot of great lessons learned and definitely good sharing for those listening who maybe are encountering the development of this program at their own institution. I really appreciated, at first you mentioned it specifically about patients. I mean, you have to introduce them to this concept. I agree with you. Having some sort of disembodied voice just start talking to me from some speaker somewhere, that would probably be alarming. So yeah, introducing this technology to patients and also to nurses. I mean, I think as technology sort of rapid fire, kind of fire hose of information of new, we have AI coming, all of these things. So I think definitely noted and appreciated that how you implement this change with both your patients and with your staff is critical to the success. They have to buy in. They have to be willing to give it a chance, whether they're directly performing it as a virtual nurse or just the receiving end of the support it provides. In both situations, you have to make sure that people are willing to give it a chance. And I think you spoke to some of the important steps to take to make sure that that is performed well. So from your experience with the program, what do you think nurses or administrators need to know if they're considering implementing or trying to pilot a similar program at their own institution?
I think that it's important that nurses and administrators know that there are so many different paths you can take to implement a virtual nursing program. You don't need to start off with the latest technology. We've talked to many organizations that have started off with iPads and a nurse behind the iPad doing admission work. So I think there's a lot of different ways to get a program off the ground. Another thing is you do need funding. You need buy-in from leadership. You need people to support it. And then something I mentioned a little earlier, that buy-in, you really need to listen to what your nurses want and need so that what you do works with them rather than against them or is seen as something that's being pushed on them. The nurses have been super excited about virtual nursing, particularly when they hear about some of the things that maybe that virtual nurse can take off their plate. But we found some important lessons from listening to those nurses about how best to have that virtual nurse introduce themselves and pop into the room and things along those lines.
Absolutely. And it changes your practice a little bit. If you do suddenly have this layer of consistent support overseeing certain things or performing certain tasks, like discharge, as you mentioned, admission or discharge, that will change your daily routine if you're working on the floor of what you can now focus your attention on or how you can plan your day. And so again, I think you said it best of just making sure that you're listening to the nurses that are there, that are participating in maybe the pilot or introduction of this program and building and growing it based on the feedback that they provide, because it has to, as you said, has to help improve their workflow and it can't impede it. And it can't be seen as just one more thing they have to do. Somehow it adds to their work. So I think it sounds like you've paid great attention to that. I think the other thing that I'm struck by is just wondering, once this catches on and becomes perhaps a mainstay in practice, how will then our electronic health record vendors create modules and things to support this? And will that improve the efficiency in the workflow? Certainly, they sometimes have to wait to see that it becomes a consistent thing before they build things to support it. But hopefully, if and when that does become part of the routine, that they'll be able to support it from the technology that they provide as well.
Very true. I do think that the electronic health records out there have started working on things within their systems to make virtual nursing better. So for us, for example, there's a patient list, there's tasks, things along those lines we have built into our electronic health record that will support that virtual nurse to provide efficient care as well as thorough care.
That's great to hear. So what does the future look like for virtual nursing? And do you have plans for expanding or growing the program at Jefferson Health?
Yes, I think that the future for virtual nursing is bright. I've been part of a lot of conversations with people from across the country interested in starting programs like this, interested in getting off the ground. For Jefferson ourselves, there's been a little bit of time between our first phase and that second phase, but we're about to hit the road hot and heavy. We have 2 other units in our health system that will go live with virtual nursing this summer after the first 2 units at our main campus. And then we have secured some funding to go live with a couple more units in the fiscal year following.
That's very exciting to hear. I think, again, having organizations that have the means, have the funding, or have just administrative and executive support to trial these things, it's going to take some of these trailblazer organizations to do it first. And then, as I said before, publish the outcomes, share the process, because I think for all the reasons that you've noted, both for patients and for nurses alike, this really could be something that augments and changes the trajectory of the pains that we're feeling of nursing shortage and nursing burnout. This feels like a very viable way to perhaps change that narrative a little bit. So I'm really excited to hear what you've done at Jefferson Health and how both for nurses and patients alike, it really is starting to provide a different way to provide care that benefits everyone. Laura, thank you so much for sharing what you've done at Jefferson Health and your vision for what virtual nursing looks like on the horizon. As we approach the end of our episode, we do like to always run through a quick series of questions just to help summarize what we've talked about today. So to start that off, how do you think healthcare professionals should evaluate maybe their own hidden or implicit bias around the concept of virtual nursing and telehealth?
So I think that one bias that you might see with virtual nursing is that certain types of patients may not be able to interact with the technology or the virtual nurse or might not be included. I don't think that's true. I think that a virtual nurse still plays a part even in somebody who is not capable of interacting with a virtual nurse or things along those lines. You can interact with their patients. You can still do safety sweeps of the rooms. There's things along those lines. So I think it's important when you're designing a program or training nurses that you don't inadvertently exclude patient populations because you've made an assumption that the technology isn't something that they would want to use or could use.
What are some common misconceptions about virtual nursing?
To me, I think some people might think a virtual nurse can't provide the same quality of care that a bedside nurse might be able to because of that lack of physical touch or presence. But I think a virtual nurse can have the same sort of presence that a bedside nurse does. I like to think of a virtual nurse as pulling up a virtual chair next to that patient and spending time to ask questions and engage with them. And another misconception that a lot of people think when we talked about virtual nursing is that we're trying to replace a bedside nurse with a virtual nurse. That's not how I see virtual nursing. And as I said earlier, I don't think a virtual nurse can replace that physical touch. What I see a virtual nurse is another member of the care team whose care complements the care the bedside nurse is providing. I don't think that we should be looking to remove resources from the bedside with this nursing shortage, but rather evaluate what our nurses are doing, identify if there's tasks that someone else can do for them so that they can focus on the patient. And there are plenty of things that a virtual nurse can do so that the bedside nurse can spend more time doing quality work with that patient.
Absolutely. I love that. What's something about this topic that's not often discussed, but you wish people knew more about?
Just that it's very exciting. I think, again, sometimes people think, oh, it's just the latest trend, but I really do think that virtual nursing is here to stay. And it's something that with some creativity, thinking outside the box, we can really do so much for our bedside staff and so much for our patients. There's so much opportunity, not just getting a virtual nurse to buzz into the room, but also what about a virtual social work consult or virtual case management or a physician or things along those lines to get them in the room. And with this technology we're using going forward, we'll be able to invite a family member or a loved one join in a conversation. So, a lot of people work full time. Maybe they can't get there at 2 p.m. to meet with that provider or the physician taking care of their mom. But if you could invite them into that virtual session and everyone can participate, you can really do a lot for that family and that patient.
Absolutely. I think something that we experience in oncology, specifically again in the outpatient setting when we're trying to provide education to a patient and their caregivers about what their new treatment plan is. It's hard for everyone to get there at the same time, or it's hard for everyone to fit in the room, depending on how many people they want to be part of that. And so I think what we saw, especially again in the post-COVID world where we were able to use telehealth and so that televisit with more flexibility, it provided that opportunity to say we could have anyone the patient wants to call into this meeting and to be able to hear what we're teaching them just to provide that layer of support. So again, I think the examples you provided about how we could use that in the inpatient setting as well to do those virtual consults or to provide that discharge and bring family in if they can't be there physically. It removes that barrier of physical proximity and allows people to just be there virtually and still hear and participate in what's happening for that patient.
Absolutely.
So what education, additional training, or other education do you think oncology nurses need to help stay current on this topic as it evolves?
I think that because virtual nursing is such a hot topic, that our nursing staff should pay attention to the webinars and conferences and the current nursing literature, but really what we need to do is start to get in front of our nursing students and incorporate virtual nursing as another type of nursing in their nursing school training. So for example, our students do rotations in different settings, like the mother-baby world or community health. Can they do a rotation with virtual nursing, learn some skills of how to communicate with a person using technology? And how can we incorporate some of that training for our nurses who are already working in our hospitals or inpatient settings would be another thing to explore.
Absolutely. And you said it earlier. I loved your term, a webside manner. I think that's a different skill set and it can be learned, but it has to be, I think, intentionally taught. The same we see sort of digital etiquette of how you interact with patients if you are doing virtual visits. So I think you're absolutely right. Incorporating that into current nursing students' curriculum, and then also providing those opportunities to train up nurses who are already in current practice. And this is just a new addition to their everyday practice. I think those educational opportunities you suggested are spot on. What are some additional resources maybe for patients or other providers who want to learn more?
So I took a look into this question. I personally haven't found one resource that has all the answers. I mean, if you do a Google search, you can find a lot of information on telehealth and telemedicine and virtual nursing. But again, like I said, I've seen so much more attention being put on for virtual nursing at conferences and webinars and the like, and that might not help a patient. And that's where I think that as we grow these programs in our hospitals, we need to make sure we have really good scripting for our bedside staff, our virtual staff, good handouts and FAQs, and answer those patients' questions, at least in that just-in-time training.
Absolutely. I think you already covered it very well, is that we just have, it's so new, right? There's nothing out there yet for patients because we're still trying it out. We're still learning about it. So yes, being able to provide the right resources, the right information to patients so that they can understand and just be on board with what's being tried. I think those are great recommendations. Laura, thank you again for joining us today on the podcast, sharing all the great information and the great work that's happening at Jefferson Health. Do you have any final comments to share with our listeners today?
No, just thank you so much for having me.
Great. Thank you, Laura.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.